Hello there and welcome once again to The Verdict. Mick Cornett with Meyers. We're here every week, as you know, meeting interesting people and dealing with topical issues, and you can't get any more topical than this. It just won't leave us alone.
Well, COVID update is what we're going to have today with Dr. Dale Bratzler, who's been on several times before. Very generous with his time, and as OU COVID officer, is right on the front line of what's going on everywhere, including a very, very large public university with lots of students to try to keep healthy.
Yeah. What's happening now? What's going to happen? Dr. Dale Bratzler with us here today on The Verdict. We'll be right back.
Right now, 6 feet can feel like a long ways away. But from 6 feet, we can still smile at each other. From our doorways and our stairways, from opposite sides of the street and opposite sides of the country. Through fear and frustrations, we can remind each other that we are still here for each other. Because we can still smile at each other. And we're not going anywhere.
Military service ran in my blood, starting from my father, which joined the Navy. On the Chickasaw side, my uncle, which served in the United States Army. I'm Benjamin Espinosa, Chief Petty Officer, United States Navy, and I'm Chickasaw. I went to the Secretary of Defense's staff at the Pentagon in Washington, D.C., which ultimately led to becoming a combat support technician for Naval Special Warfare, specifically SEAL Team 10. I think to be proud and to love your tribe, to love being Chickasaw, you also have to love being American. You also have to love everything that America stands for. Equality, perseverance, professionalism, and power. I want my family to know that their father is a good person, but also feels that he has an obligation to the country and to love this nation. Anything worth having is worth dying for. The military and the country owes me nothing. I owe it everything.
See more stories about the Chickasaw people at profilesofanation.com.
Welcome back to the set of The Verdict. Mick Cornett with Meyers. Kent's going to introduce today's guest.
We're really pleased today to have back on the set of The Verdict Dr. Dale Bratzler, the Chief COVID Officer at OU Med. He's just about as busy as anybody can be, and he's always generous with his time. But we think he's got some interesting current and future information to give to you, and we're going to look forward to visiting with him about that. Dale did his undergraduate work at Central Missouri, got his MD at Kansas City Medical School, got a master's degree in public health at the University of Oklahoma, and is board certified in internal medicine and is a fellow in the Infectious Disease Society of America. He was named by the Journal Record as Media Hero of the Year in 2021, a title that I think he'd probably rather not have had considering what was necessary to get it. But he's our media hero on COVID. He always comes and tells us and therefore tells you what he knows about what's going on. He's had many civic and cultural activities that he's been involved with and is well respected in his field. Dale, welcome back.
Yeah, thank you for having me.
And as Kent said, thank you for your time. Well, it's the last week in January. Where are we with this latest round of COVID updates?
Well, so a bit of good news. It looks like for the past couple of days, the case counts have been coming down a bit. And in fact, within our own health system, we're finding a little less people seeking testing right now. So that suggests that maybe we're starting to see the peak. We kind of expected that. But just to put this in perspective, in the last 1 week, we've had 75,000 cases newly confirmed in Oklahoma, and 288 Oklahomans have lost their life to COVID-19 just in the past 7 days. So we're not completely out of this yet, but at least for the past couple of days, it looks like the trend may be in the right direction.
Just how far above what we had experienced with the prior COVID outbreaks are these numbers. Are they just off the chart high? They sound like it.
Yeah, they've been completely off the chart. If you see any of the graphics, it looked like some people called it the wall, this straight up increase in the number of cases. So a year ago, in December, January, when we had the first, what we thought was the biggest surge, we got up to a little over 4,000 new cases a day on average. This past Friday, we hit almost 12,000 new cases a day on average in Oklahoma. So almost triple the number of cases per day have occurred with this outbreak of the Omicron variant. Hospitalizations, we're getting close. We're right at 1,868 people in the hospital today. That's close to where we were. Remember, a year ago, we got to a peak of 1,994. So not quite as many people in the hospital, which is consistent with what you've been hearing. This virus spreads easily, rapidly from person to person, but it doesn't appear to make people quite as sick, so we're not seeing quite as many people in the hospital.
The immunizations that began just about a year ago, how are they helping us today?
Yeah, so there's real good information that if you're fully vaccinated, you've gotten the 2 doses, and you're eligible for a booster, and you've gotten your booster dose, we know now that that is particularly helpful to prevent people from both getting infected with the Omicron variant, but more importantly, keeping them out of the hospital or having complications of the disease. So I think you're aware, a lot of people who have been vaccinated have been getting infected with this particular variant. It's so fast that it almost overwhelms your immune system before your immune system can react and keep you from getting infected, but it keeps you out of the hospital. So if you're fully vaccinated, boosted, that's the best place to be right now.
In the past, I guess, the number of unvaccinated were clearly the larger majority of how many people were getting sick. Is that still the case?
Well, it is. I mean, when I look at our system, about 75% of the people in the hospital that have COVID are unvaccinated, about 25% are vaccinated. Now, that number is lower than it was before. Before, remember, we were in the 90% range of vaccinated people that were, I'm sorry, 90% of the people who were in the hospital with COVID were unvaccinated. So that number has come down a bit. But what's different this time is we're seeing a lot of people who come into the hospital, maybe they're in a car accident or they have some acute medical problem and they get admitted, and we test them. We test everybody that gets admitted, and they're testing positive for COVID. In other words, it's an incidental diagnosis. It's not the reason we're admitting them to the hospital. It's the reason, it's just a diagnosis that we make when they get here. Those people can be vaccinated, but they're not symptomatic from COVID. They're here for some other reason. So that number, the percentage of people in the hospital that are vaccinated with COVID has gone up, but it's because of these incidental diagnoses.
Dr. Bratzler, are there certain parts of the state that seem to be running higher numbers now than previously?
Yeah, so this past week when the state reported county level data, clearly the population centers of the state still had the most new cases. So Oklahoma County, followed by Tulsa County, Cleveland County, and then Canadian County. Those 4 counties had the bulk of the most new cases. But when you look at it from a population perspective, it's been very different numbers. So rural parts of the state have had very high rates. From a population perspective, Cleveland County had an incredibly high rate of new cases per 100,000 population per week. That number has started to come down. But again, when you look at a map of Oklahoma, this particular variant has spread across the entire state.
The vaccination rate is what it is. But we have recently heard about these test kits that are going to be furnished by the government and mailed if you request one. Are the results of those test kits, have they started arriving yet? And assuming a viewer gets a test kit, takes the test at home, and is concerned that that test is showing a positive for COVID, what should they do? If they're feeling fine, but they have a COVID positive test, what should they do?
Yeah, absolutely. So remember, these rapid tests, these home tests, are not counted by the state health department. It's one of the reasons that we believe the reported numbers that come out from the state far underestimate the number of people in the community who actually are infected. But we tell everybody, if you have a positive test, whether it's a home rapid test or you go to a laboratory and get a PCR test, you must consider yourself infected. You must consider the possibility that you could spread the infection to somebody else. And so you should isolate yourself at home for at least 5 days. That means not going to work or going into settings where you're around other people. And then after 5 days, you can return, but you should wear a mask for an additional 5 days, just in case you're still shedding any virus to protect those around you. There's some pretty good studies now with these rapid tests that show that false positives, in other words, a positive test in a person who really doesn't have COVID, are actually quite uncommon. And a negative one of these rapid tests may not absolutely clear you from having COVID-19. And we often recommend that if you test negative, let's say you have some symptoms and you test negative, you repeat the test the next day to see if it changes to positive. But again, if you get a positive, consider yourself infected and just realize you could spread the virus to somebody else.
Dr. Bratzler, when is a person most contagious? When they first contract the disease or at some point after or before?
Yeah, it takes a day or two before you actually develop symptoms after you've been infected. The studies now suggest that when you develop symptoms, you've probably already been shedding the virus for a day or two before that. And then for the next 2 to 3 days is the peak of transmission in a person who has symptoms. If you continue to have symptoms after that 5 days, then we do recommend that you continue to isolate because you still could be shedding the virus. But influenza is the same way. People often spread the virus for a day or so before they even know they have the illness, before they have symptoms.
Dr. Dale Bratzler is OU's Chief Medical Officer and Chief COVID Officer, ready, and we'll be right back.
One of the best kept secrets about the post 9/11 GI Bill benefit is that it can be used at a trade school or a technical school, and it doesn't have to be used at a university or college. These are benefits that the veterans have earned through their service, and they should take advantage of it.
Veterans really need to understand that there are many resources offered by the Oklahoma Department of Veteran Affairs. They are there to help you find the right school for you, the school that will help you and your family make great steps into your future.
OU Law has a history and heritage that are unparalleled. At the University of Oklahoma College of Law, we empower our students to pursue the career of their dreams. We have the highest U.S. News ranking ever achieved by an Oklahoma law school. We are the first law school in the country to launch a college-wide digital initiative. And this year, our competition teams rank #2 in the nation. OU Law, generations of excellence, limitless possibilities.
Welcome back to the set of The Verdict. Our guest today is Dr. Dale Bratzler. He's OU Medicine's Chief COVID Officer. Ken?
Dr. Bratzler, talk to our viewers a minute about what you think they ought to do in several different circumstances. They are fully vaccinated. They find themselves just not feeling up to par. They have not been tested. They don't have any test kit. In that situation, what do you advise them to do?
Well, so kind of just some general things that your mom would tell you. If you don't feel well, if you're sick, please don't go to work. Don't be around other people. Stay away from school. You know, you could have an infection. It may not be COVID. It could be influenza. It could be, if you're a kid, RSV or some other disease. But just remember that you potentially could have a disease that you could spread to others. So we always recommend to people, if you don't feel well, try to avoid being around others. I strongly encourage people, there's no way at this point to know the difference in terms of a diagnosis of COVID or influenza or other viral infections without a test. And it has been difficult to get a test, but I think that's starting to ease up. The number of people seeking tests is starting to drop down. So there are a lot of places like county health departments. ME Labs has been doing a lot of work around the state. There are places that you can go to get a test. Many urgent care centers, for instance, do offer quick testing. So seek out a test if you can, if you just want to know. I think it's really important because if you're infected with COVID or frankly with influenza, then you need to stay home so you don't infect other people. That's the most important.
Let me follow up with that, if I may. What is the tipping point? When should one of our viewers, either call their primary care physician for an appointment or advice, or B, go ahead and go to an urgent care or an emergency room or the hospital?
Well, that's a little bit more of a difficult question. So the principal thing that will get a person admitted to a hospital with COVID is if they're having trouble either with their breathing, particularly if their oxygen levels start to fall, or sometimes patients will have severe fever, they may have low blood pressure, and so they're lightheaded and things like that. Certainly if you have any of those symptoms that would suggest that you're having more severe complications, then that is the appropriate time to go into a hospital to be evaluated. Many people now we can take care of at home. We can monitor some people at home with home oxygen monitoring and other things. For the most part, if you don't have those symptoms though, if you just have upper respiratory symptoms like congestion, maybe mild cough, runny nose, some people with the Omicron variant are reporting headaches. If you have those types of symptoms, then typically you can be taken care of at home. You can talk to your primary care physician, but if they think you're infected, they may not want you to come into the office, potentially contaminate other people in that setting. The most important thing is to get a test. Find out whether you have COVID or not, because if you do, then you definitely need to isolate for at least 5 days. Hospitals have been overrun, so please don't come to the emergency room just to get a test done. There are better and more convenient places you can do it, and right now our emergency rooms are full of people waiting to get beds, because in our health system, just as in all the systems across the state, healthcare workers, nurses, doctors, therapists, and others are getting infected, and they have to be isolated for 5 days away from our site of work.
Looking forward, those of us that have had one round of a booster, should we anticipate there will be news about a second booster necessary or required coming up soon?
Yeah, you know, that's a great question, and one that I don't think we have the complete answer to. So I will tell you that in Israel, they started a program where anybody over 60 or people with high-risk underlying conditions could get a second booster dose. In other words, their 4th dose of the vaccine. And what the data that's at least coming out at this point has not shown that it's been that beneficial. Now, it didn't surprise any of us that the 2 shots you got the first time were going to be enough and that you needed at least 1 booster. But at this point in time, we don't have any strong evidence that you need to go out and seek another booster. There's just no evidence. It's my understanding that Pfizer and Moderna are both working on a vaccine that is explicitly targeted towards Omicron. And so down the road, if we continue to see outbreaks in unvaccinated people or other people with Omicron, then maybe some people will suggest that we get a booster with an Omicron specific booster dose. But at this point in time, I just don't recommend a second booster shot.
Is there research going on about a COVID pill, something that does the same thing substantially as a booster shot, but doesn't require the injection?
Well, at this point in time, we have 2 pills, antiviral pills, that are now FDA authorized to use. They're still in short supply, but they're very, very effective for treatment of COVID. So if you get infected, you have a positive test, and particularly if you're in one of the categories of people who who are at risk of complications of the disease. You're older, you have underlying illness, immunosuppression, diabetes, heart or lung disease. We have 2 pills available, one called molnupiravir, which is a antiviral medication that a doctor could prescribe. You pick it up at the pharmacy, you take a 5-day course, pill twice a day. Or the other medication, which came out from Pfizer, called Paxlovid. Paxlovid is a combination of 2 medicines. You have to take 3 pills twice a day for 5 days. But in the clinical studies of Paxlovid, they found that that particular combination was about 89% effective at keeping people out of the hospital or having severe complications of COVID. So the challenge we have today at the peak of this Omicron surge in Oklahoma is it's very, very difficult to get those agents. They're just not readily available. I think within a few weeks, maybe a couple of months, we'll probably have all we want. And so for the future, just as if you got influenza and your doctor prescribed Tamiflu, if you get an upper respiratory infection, you have risk factors for severe COVID disease, your doctor may be able to call the local pharmacy or send in an electronic prescription for one of these antiviral medications, which will keep you out of the hospital or having severe complications.
School districts, school boards are in a tough spot. There's one train of thought that a kid overall is safer if they're at school. But then you have teachers who, are calling in sick, and so then, other problems start to come up. Any advice on a school board member who might be watching our show as they kind of face this on a daily or weekly basis about best decisions going forward?
Yeah, I have to tell you, the schools have had a really tough time with this particular surge. And a number of weeks ago, I had commented in the press multiple times that the disruptions of the classrooms was inevitable when we looked at how fast this particular variant was spreading through states like New Jersey, New York, and others. And as you point out, kids don't as often have symptoms, and while they can have severe complications, they don't have them as commonly as adults do. But what's happened, as you know, in many settings is that staff, cafeteria, bus drivers, people that keep the operation running, or the faculty, the teachers, they get infected and then they have to isolate for 5 days. It's the same problem and challenge that we're having in healthcare. A lot of our staff get infected and then we have to isolate them and can't have them here helping us take care of patients for those 5-day periods. So at this point in time, I think each and every school board has to look each and every day, literally, right now, to look at what's happening with the trends in the number of staffing they have, what services can they provide, which ones they may have to go to virtual temporarily. I do think this will be temporary. I actually think that we are approaching, if not have hit, the peak of this particular surge. And we'll know over this next week for sure. We may see case counts start coming down, and hopefully then we'll see far less disruption in the classroom.
Dr. Bratzler, 15-20 seconds left. What should Oklahomans take away from this show?
Well, still, by far, the most important thing Oklahomans can do is make sure you've gotten the priming series of the vaccine, and if you're eligible, get your booster dose. That will protect you for the future.
Thank you so much for coming on the show, and we wish you the best of luck.
Thank you.
All right. Kent and I'll be back with a final word after this.
It used to be okay in teachers' lounges. It used to be okay in maternity wards. It was okay in sporting arenas, college campuses, and office spaces. But now that we understand the deadly dangers of secondhand smoke, that's not okay anymore. So why is it okay that thousands of employees are exposed to it every day at work? Bottom line, it's not okay. Let's protect hardworking Oklahomans. Join the fight at stopswithme.com.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children. helping to bring hope and love back to the lives of abused children.
You will always be Mom and Dad to me.
I think for us, once we got started and we began to see the tremendous need just within our state, it really was just a calling for us. The blessings far outweigh any obstacles that we've faced.
You will always be Mom and Dad to me.
The Journal-Record is pleased to be a sponsor of The Verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information.
Welcome back to The Verdict. Our guest was Dr. Dale Bratzler, and we were talking all things COVID. You know, I think the general public, you know, and here we are a couple of years into this, is just, they want a solution, and they want it now, and they want government to fix it, or they want the private sector to fix it, and it's just not that easy.
Oh, and one question I didn't get to ask just because we didn't have time, but I wanted to ask Dr. Bratzler if we're going to be looking at COVID every year like we look at the flu every year. There's some good bit of talk about that, and I don't have the slightest idea what the answer is. But I hope our viewers got some good information about what to do, when, and how to do it, because they may be at home and not be too mobile and need to know when is the right time to call for help.
And as he verbalized, you know, one of the secondary impacts of COVID is that if you have some sort of sudden emergency, a heart attack or in a car wreck, and you get to the hospital, I mean, they can be, you know, tied up, you know, booked up. And so, you know, what used to be an emergency that could be easily handled with the available staff is now stretched. And so there are a lot of implications, you know, far beyond, you know, just COVID when our healthcare system is so taxed. A couple of websites to draw your attention to. You can reach Dr. Bratzler and his staff at ouhealth.com. That's ouhealth.com. And we have a website, theverdict.tv. You can log on and tell us about a guest you'd like to hear from or a subject you'd like to see us cover. That's going to do it for this week's show. For Kent Meyers, I'm Mick Cornett. We'll see you next week on The Verdict.